Jake at Podiatrist Professionals. I'm just going to show you two types of taping. One you can do with your partner and the other that you can do by yourself. So the first one that I'm going to do today is the one that you would do with your partner, and we'll go through it. So first step first is you need two long pieces. So you're going to measure that from this bone to your big bone over here. So you measure that by coming around to the big toe. You're going to need two of these lengths. So if you just look over here, we've just got the long piece here, and then I've re-measured that onto the second piece. You're going to need then 5 shorter pieces where I measure from the ankle bone to the inside ankle bone, just below that, and you're going to have 5 strips coming along here to compress the arch. Okay, I'm just going to run you through this. So the first one, you're going to start just behind or below this bone here by pressing that on, and so. I'm just going to come down. It's always good to give it a bit of a rub, stays on for longer. Come around to the inside of the big toe, and it should finish just below or just behind the big toe joint. Again, give that a bit of a rub. Great. So for any heel or arch pain, we're trying to compress the heel and the arch. So this is the principle we're doing here now with this tape. So we're going to grab our first shorter piece. And we're going to start just below this ankle bone here on the outside. But what we're going to do is we're just going to compress the arch and the heel. So I'm just going to compress there first. Use both my hands to push up, to compress, and come through, as so. And you're going to follow that all the way up to the big toe joint. So we're just going to slightly overlap this, just by half.
How long should people keep this on for, Jake?
So we want to be keeping this on for about 3 to 4 days. If we can keep it dry in the shower, that'd be great as well, because it'll keep the integrity for longer. So that's the first two. Third one. Slightly overlap again. Just remember to keep that compression there really nice and tight. Great, and then you get the final one.
Should people expect this to feel quite tight when they first come down from this chair? Or?
Absolutely, they should. So you should get a bit of tightness in there around the outside of the foot and into the arch, because the idea of it is to compress the heel and the arch. So we're trying to compress the fascia that runs down through here just to give us some support. So for the last one, we're just going to do what we did at the start. We're going to start from here and come around just to finish it off so it can hold it all together. So we're going to start just where we were. So this one's perfect if you have a partner to do this for you, because they can do all the compression. And again, just give it a good rub at the end and stay for longer.
And what should people do if they start noticing any redness or itching or anything else like that occurring?
Yeah. So if there's any itchy or redness, then you're likely having an allergic to the elastoplast tape that we have here today. So it'd be ideal to run it under a bit of water and start to peel it off slowly.